Vitamin B12, also known as cobalamin, is a water-soluble vitamin that performs numerous functions, including ensuring proper functioning of the nervous system through its role in the production of myelin and the circulatory system as it participates in the maturation of red blood cells in the bone marrow. Not only that, vitamin B12 participates in DNA synthesis and is involved in the metabolism of amino acids and fatty acids. Vitamin B12 is found in foods of animal origin, especially in red meat, fish, and mollusks, but also in eggs, milk, and its derivatives. Generally, a vitamin B12 deficiency occurs in people who follow a very strict vegetarian diet or a vegan diet, or when the intestinal absorption mechanism does not work well, for example following surgical removal of the stomach or small intestine, to a chronic inflammation of the pancreas, to the intake of certain medicines, or to some genetic disorders. Vitamin B12 deficiency is quite common, and in the United States and UK it is around 6%, while in developing or underdeveloped countries the rates are higher, especially in children. In Latin America it reaches 40%, in some parts of Africa 70%, and in some parts of India even 80%. But what are the characteristic signs and symptoms of a vitamin B12 deficiency? Let's go see them. Chronic fatigue. Fatigue, weakness, and shortness of breath can all be due to a vitamin B12 deficiency, main cause of megaloblastic anemia. It is a form of anemia in which the red blood cells, due to an alteration in the synthesis of DNA, have a maturation defect, that is, they have an excessive cytoplasm compared to their nucleus. These megaloblasts thus accumulate in the bone marrow and blood, where the red blood cells become larger than normal. In megaloblastic anemia, the average concentration of hemoglobin contained within red blood cells is lower than normal, thus reducing the blood's ability to carry oxygen from the lungs to the tissues. This explains the feeling of weakness and chronic fatigue experienced by sufferers. Other symptoms of megaloblastic anemia are brittle nails and hair, periods with low-grade fever, and pale skin, especially on the face. Neurological disorders. Symptoms of a vitamin B12 deficiency include numbness or a tingling sensation in the hands and feet, up to the onset of serious irreversible damage to the brain and nervous system. This happens because the lack of this vitamin causes demyelination of the nerves, that is, the thinning or complete loss of the myelin sheath, a substance that coats nerve fibers. When this coating is damaged, electrical impulses are not transmitted correctly along the nerve fibers, and there will thus be a slowdown in communication between neurons until the definitive loss of nervous control. Other neurological symptoms due to a vitamin B12 deficiency include difficulty walking, dizziness, and loss of balance. Difficulty concentrating. Vitamin B12 ensures correct brain development, starting from the fetal stage, and contributes to the proper functioning of cognitive abilities in adults. A lack of vitamin B12 is responsible for the onset of cognition and memory disorders. Among the most common symptoms, we find a lack of concentration and cognitive fog. The latter is not actually a medical condition, but a term used to describe a feeling of mental confusion, where we feel lightheaded and disoriented. This brain fog causes your thinking to slow down, and as a result you will need more time to complete even the simplest daily tasks. Glossitis. The term glossitis indicates any inflammatory or degenerative process of the tongue, or only of its mucosa. It can be caused by the consumption of particularly hot foods, smoking, alcohol, but also by a lack of vitamin B12. In the case of glossitis, there is a thinning or disappearance of the taste buds that cover the surface of the tongue, thus making them look smooth and red. You will feel pain and burning when chewing and swallowing, especially when you consume very hot, cold, or particularly spicy foods. The morphological modification of the tongue caused by glossitis can also make phonation and in some cases even breathing difficult. Blurred vision. People who have low levels of vitamin B12 may experience problems with their vision, making it blurry and disturbed. Since vitamin B12 deficiency affects the nervous system, the optic nerve can also be affected. This is the second pair of cranial nerves and has the task of transmitting electrical impulses from the retina to the brain, which will have the task of interpreting them and generating a visual image. One of the consequences is optic neuritis. That is an inflammation of the optic nerve, which causes severe blurred vision, a reduction in color perception, bright flashes in the absence of light, and spots in the visual field. You usually experience gradual or sudden loss of vision, partial or complete, usually in only one eye. Fortunately, this is a rare complication that occurs in less than 1% of patients with a vitamin B12 deficiency, but which must still be taken into consideration, as early diagnosis can prevent irreversible vision loss. The extent and duration of symptoms depend on the severity of the vitamin B12 deficiency. If you notice one or more of the symptoms described, always talk to your doctor or specialist. If treated in time, and if the cause of hypovitaminosis 12 is reversible, the cure consists in taking this vitamin orally through supplements or through intramuscular injections. Prolonged vitamin B12 deficiency can cause severe anemia, irreversible damage to the brain and nervous system, as well as reduced heart function.